Welcome back to Cox Connections, exclusively on Cox 9. I'm Margaret-Hunter Wade. The CHIP Fit program is in its second year with the help of a Cox Charities Grant. The program provides nutrition and exercise education to families in an effort to establish good, healthy habits before children enter school. CHIP CEO Robin Haldeman is here to tell us more. Thanks for stopping in.
Thanks for having me.
Good to see you. So let's start with an overview of CHIP and really kind of what you do and ultimately the benefits to our region.
Okay. Well, CHIP serves families in poverty from prenatal until the child starts kindergarten. We are a home visiting program, so we serve about 1,100 children a year and do between 400 and 500 home visits a month. We have registered nurses and case managers and mental health case managers that just wrap supportive services around a family and a child to get them ready for school.
So why these early years? What is the significance behind that? Why don't you go past kindergarten?
Well, brain development is so important in those early years of life. You know, that's when everything is happening neurologically and the child is developing all the skills necessary to learn to read and cognitively and emotionally. It's just such an important period of time that's when we can make the most significant impact.
All right. So Cox was pleased to award CHIP another $10,000 grant through our Cox Charities program this past year. And this is the second year, as we said, for your CHIP Fit program. So what is this program exactly, and what was the idea behind it?
Well, we started seeing our children were born very underweight, and by the time they were 4 years old, they were significantly trending towards overweight. So we thought, you know, we've got such a wonderful opportunity while we're in the home, mentoring the parent and coaching the parent to help establish some healthy lifestyle choices for the parent and the child. So we looked around at curricula, and one of the curricula that we chose was endorsed by the American Academy of Pediatrics. It's called 5210, and it focuses around 5 servings of fruits and vegetables a day, 2 hours or less of screen time, 1 hour of outdoor exercise, and 0 sugary drinks. And that's what we enforce on the home visits, just really talk about that and how we can make that happen.
So really breaking down what it looks like to lead a healthier life, because sugary drinks, I mean, obviously that was a major component if that's actually a part of this program.
Yeah.
So what's the link here with low-income families, and why are we seeing, you know, these issues?
Well, there's multiple reasons, you know, socioeconomic reasons. It's very expensive to buy fruits and vegetables and eat very healthy. So we're helping them find ways to do that. Now you can use SNAP benefits out on the farmers market. We give them recipes for healthy choices for dinner. And oftentimes neighborhoods are not safe. The parents don't feel safe letting their children outside to play. So, you know, talking about going to the park together and walking the greenways, there's just many things we can do to help them explore the outdoors and gain exercise. And the whole family ends up doing things together.
So this is in its beginning its second year, or currently in the middle of its second year? Is that
it's
right?
In the middle of the second year.
What have you seen so far? I mean, I know it's probably hard from a statistical, you know, analysis at this point, but just, you know, qualitative, you know, just notes that you've gotten from folks.
Yeah, anecdotally, we've heard that, you know, a lot of the recipes that we're sharing, the moms just had no idea, you know, how to make beans and rice, just simple stuff, and how good it could be, and the kids are enjoying it. We're doing cooking classes as well, and they're just loving that, and learning how to cook with their child, and just what ingredients are healthy and what are not healthy. We are hearing from parents that their children are finding different activities to do other than sitting in front of the TV, and parents are starting to learn too how what they're doing is affecting their children. So they're making different choices for themselves as well.
They're a model for their children when they see, you know, sugary soft drinks in the home and their parents drinking them, then why can't I have that?
Right.
So yes, it's very true. A whole community effort in the end. So if a family is looking to get involved in the CHIP Fit program, they have to be already served by CHIP, is that correct?
Yes, or enroll in CHIP.
Okay.
So the guidelines for that are you need to have a child who's age 4 or under, or you're pregnant, and you need to have an income of 133% of poverty or less, which means typically the child has Medicaid for health insurance.
And after that, they're eligible. And then how do they get involved with you all specifically?
They can just call the office, and we'll send a registered nurse, a family case manager out to enroll the family, and then we start the home visits, and we will start CHIP Fit at that point.
And as far as the home visits go, what is they're coming in and assessing, and then you can serve the individual needs of the families?
Yeah, we do a health assessment on the child as well as a developmental assessment. So we're doing assessments on that child until they start kindergarten to make sure that they're hitting all their developmental milestones. If they're not, we can give the family activities to do to help move those developmental milestones along. We will case manage if the child has asthma. We have relationships with all the physicians' offices, the pediatricians' offices, so that we can get their medical records and track their well baby visits and their immunizations. So it's very holistic. It's health, it's development, it's getting that child and family as healthy and strong and together as they can possibly be before that child starts kindergarten.
Yep, because like you said, I mean, all of that is what makes for a successful start in life.
That's right.
Folks can also come out and help you all as volunteers. What's the best way for people to get involved?
Well, just call the CHIP office, 857-6993. We need help with our cooking classes. We need help with our family fun days to get children outside and at the parks. And then we need lots of other help at CHIP too, in the office and doing mailings and in all kinds of ways. So we use about 3,800 hours of volunteer time a year.
Wow. So. Well, hopefully we'll find some folks to help you. But we appreciate all you're doing, and thank you for coming in.
Thanks for having me.
If you'd like more information about CHIP or CHIP Fit, visit them on the web or contact them using the information on your screen. Coming up after the break, Brian Badager, the 2014 Cox Conserves Hero, talks about the recognition and his work with Pathfinders for Greenways. Stay with us.